Hi, good morning, everyone. I'm Theo Souls. I'm the founder of UX Healthcare Europe. And we're delighted to be hosting our, that's good. We started in 2018 with UX Healthcare London and been going strong. Unfortunately, we had to relocate and just go online. We're very fortunate to have a gentleman, the CEO and founder of CyberDuck, joining us today. Firstly, I want to say welcome to everyone joining us from around the world. I know we have some representatives from Pfizer in the US, some people from Singapore and Hong Kong joining us as well. So we just want to welcome everyone from around the globe. At this moment, we're sitting on 226 people joining us live. So welcome, everyone. I hope it's going to be a fun couple of days. Please, by all means, ask as much questions as you want to.
Thanks. So hopefully you can all see my screen and hear me okay. So yeah, I'm Danny Bluestone. Today I'm going to be talking about the good, the bad, and ugly of healthcare apps. So we've looked at a number of different national apps, and that's what the talk's going to be about. So just a little bit about me. So my name is Danny Bluestone. I run a digital transformation agency called CyberDuck. So I've been working in tech now since the late 90s and pretty much majored in user experience, design, as well as different aspects of technology. So at the beginning, I was kind of a jack of all trades. And actually what really led me into tech, it's quite an interesting story, is actually I was a DJ and started to build websites for DJs back in 1997, 1998. So that's really what gave me the passion that I started with. Eventually I took a master's degree in human-computer interactions. It was called Design for Interactive Media. Today it's called Creative Technology. And then sort of really went heavily into the world of usability, UX, and interaction design. So I started CyberDuck, it's actually 18 years ago now, to really become a conduit between design, technology, and content. And then I guess my interest really in healthcare started when we started to have kids. I wasn't sort of one that regularly went to the doctors, but once we started to have kids, I started to really see how at least in the UK, the national healthcare system was sort of struggling with digital in a really fundamental way, to a point where during the pregnancies and when the kids were very young, everything was sort of 80% probably of interaction was still pen and paper. And this was 4 years ago, so it's not too long ago when we had our second child. So yeah, it's really quite interesting. So in terms of CyberDuck, so we're a digital agency. We're focused on digital transformation, service design, as well as open source technology. So it's a really interesting business because we help our clients with digital strategy and transformation, including design thinking, but also have a very strong team of coders, software architects, developers. So I get to see the whole spectrum and gamut of technology with all the clients that we have. And our clients include banks, they include biotech, medical businesses, even the National Health Service. We've got quite a few projects that we're doing with them, not within the national healthcare app space, but surrounding that. And we also work with universities and governments as well, all over the world. So it's a really, very, very delighted to be able to do what I do. Let's put it that way. So besides the experience that I had with the kids and just sort of seeing some of the fundamental challenges with electronic health records, I also had a situation where my own mother, she almost died, again, because of wrong diagnosis and not having what I think is a great national healthcare app to inform her about the various medical data that she had. So here my brother, who's a musician, wrote about it wrote about it on a very well-known website called Billboards. Luckily, my mother survived, but again, what I did see is just a fundamental problem with how apps were basically working or not working. In the sense, she didn't have any visibility over her health records at all, which could have that combined with better diagnosis could have really helped her to avoid the situation that she was in, and where ultimately she was saved. Her life was saved by a triple bypass surgery. So taking a leaf from countries like Israel and Estonia and others who really proactively digitized their healthcare, they're now shifting their national healthcare apps to a preventative healthcare one, where systems and apps actually notify patients about checkups and prescriptions, etc. So what I want to do in this talk is look at how healthcare systems like the NHS could be more proactive through a better usage of electronic health records to transform the patient experience. Obviously, when we talk about designing these types of digital products for healthcare services, we really do need to think about the usability and the efficiency to really deliver that patient centricity. So let's start with our journey. Despite the advancements in the early 90s, globally speaking, the healthcare industry, and this is in all countries, or many of them, suffer from large complex systems with very strict regulations with regards to data. Now, these regulations are in place for obvious reasons, but there's little interoperability, meaning that it's difficult for systems and different departments to talk to each other. And more recently, the World Health Organization released their global strategy on digital health 2025, which actually sets out a vision for a global strategy to create a real shared understanding among member states regarding the importance of health solutions and really an approach for that interoperability across the digital healthcare ecosystem. So electronic health records today are the norm, actually. So it's not that they're not being used, they are being used. So within the EU, 96% of GPs use electronic health records. And the European Union identified Estonia, Denmark, and Finland as really leading the way in Europe. I mean, I'm not sure how much you know about the European space, but Estonia is really considered to be the pinnacle, where all of the medical data is actually accessible online. But in this particular presentation, we'll talk a bit more about Finland actually later. But yeah, to really sort of get the apps powered up and really useful, full of utility, the healthcare system behind the scenes really needs to be fully digitized and connected, and this is really yet to be rolled out in most countries. Many countries in Europe and obviously over the world are way behind where they need to be. And in this talk, we'll explore some of the complications. I mean, I guess you can see in the screenshot here that there were several articles over the last 10, 15 years about the NHS and the delays in it becoming sort of truly digital. But actually what was a real catalyst was obviously COVID. Many, in fact, most countries started to develop healthcare apps that really were pivotal in saving lives, and that then led to a real uplift in the usage of apps. So in the UK, for example, last month, 75% percent of people are actually registered on the NHS Health app. But the patient experience cannot work without having all of the HCPs, healthcare professionals, and other medical bodies having the right type of journey to enter, process, and transfer data between different departments and surgeries and pharmacies. And to really do this, they need a central data repository. The healthcare professionals need the right interfaces, systems, and interoperability. And until this is truly working, the patients won't be able to access the features that they want and complete the tasks that they want to set out. At the same time, the bar is being set very high. There's a wealth of apps that work really well related to healthcare, not necessarily national apps, but other types of apps that are truly magnificent. So the user experience is the mental models are essentially based on what the great apps that they've seen around that they use. So telehealth, medical advice, national healthcare apps can really they really do play a small part in the healthcare in the health app landscape because of what you see here on the screen. Really, there's an abundance of apps, from weight loss to sport and fitness trackers and stress reduction apps. So again, all of these apps are really being widely used, whereas in some instances, as we will see later, the national healthcare apps are barely used, actually. So yeah, so as you can see on this slide, lots of healthcare apps are being widely used. This one on the right hand side is Strava, which obviously again has some health data as well. So in terms of like what constitutes of a successful health app, let's sort of dive straight in. So this is a study from Shenzhen University in China, and the researcher highlighted 10 attributes or 10 elements that make national healthcare apps usable. So the first one is information quality. I'm not going to go through every single one because of time. I'll just focus on 5 or 6 here, really. But the first one is information quality, where it's important for the user to have accurate, relevant information, including timelines generated by their national health app. The second one is technical functionality, where the application needs to provide the right type of utility, operational outputs, and obviously be stable. What we're actually seeing in a lot of national healthcare apps that we've looked at is they're not actually stable, and they're very buggy, and they have like lots of pop-ups, and which is obviously very frustrating. The third aspect is mobility, and that's the degree that patients can use mobile health apps regardless of the location and time. Like that, there is an expectation that these apps should work offline and be more seamless. Then there's international support, as well as the perceived security. So the extent that security of the consumers and the sensitive information is being used. There's still a lot of concerns about that. And interestingly, like emotional support, because obviously quite often apps will be presenting critical health information, and obviously when for example a patient receives particular news or data, it's really important that there is some type of emotional support, which is again is very challenging, because how can you be emotional within an app? Of course, there are ways to make things more emotional, but that obviously is certainly an important element as well. So what are the real barriers to success? Because it's all very easy to say all of this, but what are the barriers? So there's obviously complex systems and operations, and it's basically not just across regions, because some countries, for example, you can only use the app within your region. If, for example, a patient is moving to another country or location, then that makes things even worse. Then there's things like regulation, which again rightfully has to be there. There has to be governance around medical data, for obvious reasons, but obviously in a way it does constrain what the apps and portals can do, because you've got, I mean, it's not too different, for example, to a flight booking app where multiple systems, both from the airline are talking to each other, and that's when you start to see real problems in like when you're booking a flight, as an example, because it has to take the data from so many different places. Then there's like the ethical side of things. There's obviously a lot of people, and again, partially because of what they read in the tabloids, won't have trust in technology and how technology companies or even governments handle their data security. The other aspect really, or barrier, is really costs, because it really does need, and it's not just within the app itself and the team that are designing and building and maintaining the app, it's all of the systems and digitalization behind the scenes, from the moment a practitioner is actually entering the data to where that data is going, how that is then linking into wider systems and other departments and other clinicians, all the way to pharmacies. And ultimately, there's user acceptance as well. Even with the best apps and the best user experience, governments and app providers still need to put quite a lot of energy and effort in to normalize and actually change the user's behavior. So in terms of Finland, that's I'm not sure how many people from Finland are here, but you'll probably know quite a lot about this. But let's just look at Finland as one of the countries that's making some great progress in this area. So just a few things about Finland, for those of you that aren't aware. It's a small 5.5 or 5.56 million people, aging population, and highly geographically dispersed. It doesn't just have a standardized national health service. Employers must also provide a occupational healthcare policy as well. It's a mixed system. It's not totally free like the NHS. There's out of pocket costs for all health visits, but 25% of that is actually paid for privately, and then 22% of the population has supplementary health insurance to cover those out of pocket expenses. Due to sort of the fragmented healthcare system, because there were over prior to this new initiative, there are 195 organizations responsible for the healthcare services, and they've now been transferred to 21 well-being services across the country, with the main one being in the city of Helsinki. Now, this is a big reform, because it's actually helping with the digitalization and all of the processes behind the scenes. And this almost revolution can be considered one of the biggest in Finnish society. So this is more than just digitalization in terms of what Finland have done. It's actually digital transformation. And there's three reasons why Finnish governments have really tried to do this, and finally, I think, succeeding. They want to obviously reduce the costs around just around the maintenance of these systems, because obviously if you're spending so much money into your digital systems and there's so many inefficiencies, then obviously it's going to reduce ultimately the physical quality of healthcare. Then there's the second main reason again is inefficiencies, where they had this fragmented structure, which caused all sorts of problems around the lack of care and waiting lists, etc. And then obviously the system was complex with a two-tier occupational and private system as well, which needed to be factored in to all of this. Here's just a quick timeline. I mean, this happened in 1995, but there was a national strategy for e-health. It was developed further in the early 2000s and backed by law. As early as 2007, the majority of the records were digital but not interoperable. Then there was an effort around digital prescriptions, and that's when this new e-health architecture called Canter started. And this is what we see today. And then on top of this now, there's lots of innovation and continual improvement. So let's look at a bit more what Canter actually is. So from a health service perspective, the main purpose of Canter is really to provide interoperable data infrastructure and services. The users of Canter are obviously Finnish citizens or patients, pharmacies, healthcare services, and social welfare services in both public and private health. So these are some of the key features that you can see here. I mean, there is an aspect, as you can see with the flags, where the prescription service is supposedly available in other countries. If you're a Finnish person away, in theory, this should work in other countries like Portugal. So in terms of MyCanter, from an EHR perspective, the core functionality allows people or patients to access their full electronic health records. It allows for prescriptions. It also allows them to see who's accessed their records and give permission. There's elements of organ donation, and also manage their dependents' electronic health records as well. So many of these things are things that, for example, we don't see here in the UK just yet. 92% of adults in Finland use MyCanter, and really the core functions that we use the most was browsing prescription information, viewing health records, and reflecting back on appointments. Now, the integration side of MyCanter is obviously key for expanding its utility and use cases. There are currently 4 apps, at least as far as I know, that work with MyCanter. But there is an act, Client Data Act, that will enable people to consent to actually share their data with the Finnish Medical Helpline as well. So that's their equivalent of 111. So obviously users will need to consent to this. And obviously, yeah, there's ongoing effort to extend and expand this. But whilst Canter essentially acts as an interoperable spine, that there are issues, the usability issues. It's made, Canter's making obviously one of its 2023 priorities a mission to tackle a lot of these usability problems by offering better management. And if you look at some of the stats here, for example, only 40% of healthcare professionals agree that terminology is clear and understandable. And this stat isn't the best either, but only 33% of HCPs agreed that entering data is easy, and less than 50% agreed that the fields and functions are logical. So there's still a lot of work to do there. So Obviously, another key component is, and again, if you're a doctor or healthcare professional, you know this. It's effective communication between different medical practitioners to each other. I mean, again, as I mentioned at the beginning, I saw this when during the pregnancies that we went through, both pregnancies, that there was extremely poor communication between one nurse to the doctor, and then from one nurse to another nurse. At least in the UK, this was primarily because a lot of the notes were written by hand and then entered into a computer, or even worse, there were situations where we were walking into rooms with just hand notes, handing them over to somebody else who couldn't read the notes. But yeah, I mean, 64% of healthcare professionals felt that the collaboration between different HCPs and departments was poor. So yeah, there's a lot of work that needs to happen here. So again, this particular data or stats here isn't the best either, where only 7% of the healthcare professionals agreed that the information systems really improve the quality of care. So again, lots of improvement that's still needed. And then a large-scale study looked into what patients actually, what type of utility they're actually interested in. So as you can see here, obviously things like prescription renewal, viewing prescriptions, being able to look at the tests or test results. So again, just sort of drawing a parallel to here in the UK, it's still not possible to view your test or examination results yet. Obviously, viewing the notes from the healthcare professional or doctor, which again in the UK is still not possible, at least from what I've seen. And there's obviously various others. At CyberDuck, we have something called the 5 pillars of inclusion. So what we did is just apply that to some of the research that we found based on the MyCanter. And actually, if you look at the stat here, 8% of Finns don't use MyCanter, so those are adults. And here are some of the reasons: lack of digital literary skills or language skills, like Finnish isn't their first language, for example, and they can't access the app and the portals in other languages. Accessibility, difficulty using the app and website due to impairments, for example, visual impairments, motor issues. There's another reason, which is safety and the lack of trust. And then connectivity is being another, just sort of not being aware of the value of connecting up and using the app. And then affordability. So some people may not be able to afford the right type of devices to actually access the technology in the first place. So it could be due to not having this is more to do with connectivity, the right type of internet setup as well. We also ran a qualitative study here at CyberDuck around how they use national healthcare apps, and we ran this with 50 respondents. 87% of them were from the UK. Almost 70% were sort of millennials, Gen Xers. Less than 4% said that they don't use the apps at all. And then we ran some qualitative interviews with some of the people from outside the UK as well, just to sort of understand a bit more about their healthcare apps. So this is quite interesting here. The people who didn't use the app, said they had no particular need for it. And again, it could be because they were healthy and just don't use the app at all. And some of the users said that they felt that the app was useless, which is quite interesting. We then looked at user ratings of different medical apps around the world, and what we actually found is that the feedback that we received in our qualitative research was very similar. There were lots of user complaints around a lack of functionality, poor usability, and this is mainly because the different services behind the scenes weren't actually joined up. Interestingly, Clalit, which is an Israeli app, so they have free national healthcare service apps in that country, got a very low rating, even though it had very or fantastic functionality. But that was so it actually dropped massively the rating on the App Store, and that's because the app went through a major upgrade that ended up breaking lots of the functionality, and users no longer being able to use the app. So that's a really quite interesting lesson there for anyone in this talk that is responsible for their healthcare app is remember not to break it. Many of the US-based apps had a really high score, and that's we'll explore why in a minute. But what are the key drivers for users? So this is primarily from our own research. We identified 6 main drivers behind a national healthcare app. Functionality is one, like does it give me the right functions that I require as a patient? Simplicity, is it straightforward and easy to use? Accuracy, is the information helpful and accurate? And then obviously security, does the app keep my information secure and protected? And then obviously personalized, does the information is the information tailored to me and my specific needs? And then mobility, so these are things like, can the app work offline? Is it truly a mobile app? So essentially, these are the 6 needs that we've identified as being fundamental. So on the next section, we're going to explore this in more detail. So this is the MyChart app from America. So from what I understand, it's like a white label app that connects to different insurance providers who ultimately provide the services in America. So meaning that people obviously pay and then pay insurance and then ultimately insurers pay out. But yeah, it's got a very high rating, an extremely high rating, and from what we've read and obviously spoken to users as well, because we have some American staff that use it, they were praising the app due to the ease of making appointments, viewing medical test results within the app, and within our own qualitative interviews that we ran, this particular function was extremely important to the users that we spoke to. Furthermore, the user that we spoke to praised the notifications, again, which let them know when it's time to receive a vaccine. So like obviously just drawing a quick parallel to here in the UK, there's absolutely no notification at the moment to getting, let's say, COVID top-up. And I think that because of the setup in the US, there's a real focus on using technology to really elevate the patient experience. Obviously, central to good functionality is really mobility and interoperability. Mobility is really important. So I'll give you an example. Some of the users, the Portuguese users that we spoke to, said that the national app over there only works in their regions. If they go to another part of Portugal, and so let's say if someone's living in Porto and goes down to the Algarve on holiday and wants to see a GP, things happen. They can't use the app. So again, it's just showing the problem with decentralized systems. And then obviously many users that we spoke to said that they want the app to work offline. So that is a really kind of interesting one, and it's not necessarily easy to do from a functional perspective unless the app has really good caching as well. Obviously, people differ massively in usability needs due to sort of impairments, age, digital skills, and sort of many factors. And obviously, this will ultimately impact how they use technology. But having sort of, I guess, English as a second language or Finnish as a second language poses the question, should apps really be translated into other languages? And that's really an interesting question. And I think in many countries, and we'll see another example later, the answer is ideally yes, because not everyone can understand one language perfectly. Here we're looking at accessibility, and I know the NHS app has improved quite a lot, but I also remember this. So these obviously aren't my comments; these are from qualitative research and users that we spoke to here in the UK. But we heard many instances where the account setup was problematic. People getting kicked out of the app and having to sort of re-enter all their information. I do actually recall when I first downloaded the app in 2020 that the same thing happened to me. So there were, I mean, one of the things that I think is slightly problematic at the moment is within the NHS app, there is a tremendous amount of like pop-ups and kind of disclaimers, to a point where it pushes all the content heavily down, and it's just sort of almost, there's a bit of bombardment with notifications that are just sort of almost like generic, which I think could be better. These are some other comments that we received from users. This one here, for example, said that this particular user said that they couldn't access their blood test results, and that they contacted their GP who couldn't understand why. Now, obviously, when I looked at the app, I couldn't see a place that actually displays results, but that might be because I haven't been to the doctor for quite a while. So, but yeah, it's a fairly standard. We can see from research that this is a feature that many users want. And another comment here is from this particular user that was saying that they believe that it's not possible to view all of their health data stored by the NHS, and there's almost an expectation that this NHS number should be able to access every single database within the NHS. Obviously, as you can see from the app updates, it's not really focusing on these issues, but I personally haven't seen the roadmap, so it could well be that these features will be released soon. Just to give you a parallel example, this is the Israeli app from Maccabi, which is one of it's the second national health service that they have, with just a quick translation. And obviously one of the users at Cyberduck gave me a demo of how this app works, and was showing me all of their medical data during a user interview, and it was truly rich in terms of the information, the data that you see. So he showed me all of his test results, all of the annotations from the doctor of the diagnosis. So the ability to just book an appointment through the app. I believe that in the UK, for example, you still need to pick up the phone and call, unless the surgery has a separate booking system. At least in my surgery, you have to pick up the phone. So these were quite interesting. One of the looking at the App Store reviews, the app has excellent reviews, but one of the big complaints, obviously Israel being a multi-lingual country, is that the app isn't available in other languages, which is what we were saying before. But back to our survey. So we asked a number of questions. One of them was around personalization, where 72% of 50 people said that they want personalized advice about their health, not just crib sheet answers. Other users were also saying that they want predictive health using like genetic data. So for example, they wanted the app to connect to the likes of 23andMe and MyHeritage and other apps that provide genetic information through genetic testing, which again would allow for real personalization as well. But obviously this is all really idealistic, but obviously balancing this personalization with data privacy is obviously on everyone's mind, or most people's mind anyway. And it's I think when we subscribe to services like Netflix or Prime or Spotify, we don't really care about personalization and privacy, because it's just all it is really is entertainment data. Whereas when it comes down to our health, we know that there's sensitive, and again, sensitive under GDPR, but also sensitive in our own heads. We obviously do think about privacy at the back of our minds. In terms of information accuracy, the NHS does appear strongly. They have a very well regarded, almost like repository for health conditions and what it actually means. And in fact, some of the Portuguese users that we interview said that they actually, when they experience health conditions, they actually go to the NHS website to learn about the different conditions, because it's considered such a high source of trust. And according to those users, there isn't an equivalent in Portugal. But at the same time, it still is, as per this user comment here, it is a bit of a minefield if you start to Google and get you will find conflicting medical advice online as well. So this is a really important one, that data accuracy. Like many of the users that we spoke to want to be able to challenge and flag inaccurate data. And they basically, the users were saying that they weren't able to change the data. This is obviously also, we were studying some external medical reports as well about this, and this is something that was validated by all sorts of other reports. And obviously data can go wrong within these apps due to a number of reasons: human errors when entering data, systems not being set up correctly, and not being able to enable almost that two-way communication that we were talking about earlier. E.g., a patient can't go back to their GP, and their GP can't edit the data and then transfer that to another department and then bring that back to the app. So that there are lots of other issues, including like data extraction errors between systems. So this is obviously a problem. So just to summarize, I think we're sort of 40 minutes in now. There's obviously system factors, behavioral issues, and technology all creates this type of complication. Decentralization is obviously a big problem. There is a mismatch between what the user wants and what is actually delivered to them through the app, and this again could be down to a lot of organizations not running the right type of service design and unable to really push the change management to the data kind of architectural layer as well. So yeah, I mean the app itself is literally like the tip of a gigantic iceberg of lots of complexity that sits beneath it. And it's getting even more complicated, as you can see from this graphic, which is like the EHR, electronic health record, US market. There are so many complexities between vendors, even with regards to data, workflows, governance, technology, and obviously various government considerations as well as society challenges. So yeah, the electronic health record systems and the national healthcare apps are just like the entry point into this massive ecosystem, where lots of things are happening in the physical world and they're sort of struggling to manifest to the tip of the iceberg that we saw before, really. So I'll just sort of summarize really the main kind of takeouts here. None of us have got the luxury of starting with a blank sheet of paper. We're all working within very complex systems with a lot of legacy technology. But I think that what we can do to really push things forward is do the following: is obviously governments, and we've seen this here in the UK with NHS Digital being able to do incredible things by having specialized digital units that are not just looking at again just the immediate sphere, but looking at society at large and mapping out all sorts of journeys that you can see below with service design to really sort of map out the all of the journeys and blueprints. But then there's centralization. Effective apps cannot be created without real centralized and well-designed systems. Then, and again, this is almost like a dream at the moment, but imagine if somebody's living in France and is moving to America, and there's real interoperability where all of their legacy health data will simply work with new providers, for example, if they move to another country. I've seen all sorts of examples of, on GitHub of sort of records and data models, international ones that are being pushed by MIT and all sorts of other universities. And I know that some countries have adopted them better than others. Obviously, user research has to be a pinnacle of all of this, across not just obviously patients themselves, but across healthcare professionals, because they're as important users as the patients. And then obviously private role sector. So obviously, when we think about the national health services in different countries, it's not just them. There's pharmacies, there's other vendors that all need to play their part. So for example, if you think about Apple products, Apple watches, they arguably and debatedly include medical or healthcare data, which could be really helpful if it were to be, for example, combined with other data from your national healthcare app. So it's things like that. As this technology is going to advance, it's going to move from health to potentially being even medical data as well. Then the technology stack, so having a modern API stack with privacy or secure by design principles that has to be conceived from the outset. And then we haven't really spoken about AI, but obviously many of you have probably seen videos recently where ChatGPT, for example, is already, you can put your symptoms into the interface and it's already telling you basically what, or almost advising you on what your condition may be, or ways to treat conditions. Of course, it's never going to replace doctors, but just imagine this type of technology being able to connect to your medical data, which in theory is possible. Again, it's a whole other talk. And then obviously the organizations that are driving their apps forward really need robust program management using lean and agile methodologies at a government level to really get this to work. And that's not easy, again, easier said than done. And then finally, as I mentioned before, I think service mapping and journey mapping and service blueprints could really help, combined with fantastic user research to map out the right type of future operational services. So that's me. I hope you've enjoyed this, and yeah, have a great rest of the day.
Thank you so much for that, Danny. Really appreciate it. There was some thoughtful insights there. We just have 3 questions. We've got about 5 minutes just to knock them out. One of the questions we have from Emma is that we've heard a lot about what users need. I'm sure the likes of the NHS app team are well aware of these needs, but are often hampered by constraints like lack of interoperability between systems due to market dominance of tech suppliers, for example. I'd be interested in your views on how we can start moving forward towards meeting some of these needs. What are the big challenges and how do we address them?
Yes, it's a fantastic question, Emma. I mean, I think ultimately the directive has to come, if obviously one of the barriers, and obviously I did mention it, is the lack of centralization, the lack of interoperability, and various kind of tech vendors not necessarily, and again, it's not their fault, but they're not able to facilitate, then there needs to be high-level directives. So from government and or heads of NHS to say, actually, this is the type of system. Again, there's a very famous quote from Steve Jobs that I'll share with you, is that you don't start to create a technology or utility with a technology. You actually start with the user experience and then work your way backwards to the technology, right? So obviously, if ultimately the dream or the vision is to create a very seamless app and functionality that connects things together, but the actual app can't facilitate, then you have to change the technology. Ultimately, that's the only way forward. You have to change the technology, because if you start with the technology and then work backwards, it's just not going to work.
Okay, great stuff. Just another one. I think you've answered the other question as well, but what should users have access to their healthcare data, in your opinion?
Absolutely, yeah, absolutely. So I'm not sure if any of you know, but Tim Berners-Lee, the inventor of the World Wide Web, has come up with this concept called solid pods. And essentially what a solid pod is all of your data, healthcare data, banking data. You will essentially host and own your data, your medical data. Everything will be controlled by the user and will be stored on almost like this database that you have and own, and you will then provide access to government services, even to Netflix and Apple. So essentially, all of your data will be stored by yourself and controlled and owned. So that's pretty visionary. I mean, he is a visionary guy. Ultimately, he invented the World Wide Web. But I really love that concept and idea. I hope that answered the question.
Yeah, totally. I know there's a few companies that's working on blockchain solutions, which allows you to share your wallet address.
Yeah, absolutely. I mean, I think his whole notion, like Tim Berners-Lee, is like blockchain. I mean, he spent several years studying blockchain and then decided the blockchain itself isn't isn't the right technology, which is why he invented this new technology, which he was talking about it at Web Summit 2022 last year in Lisbon, and it's had major kind of press attention and had some massive PR. I do really love the idea, and I do think it's logical because with people owning their data and controlling their data, I think it could be potentially wonderful for the future, particularly with AI as well, because the whole thing with AI is like, if you're inputting data and AI is essentially sending your data to a third party, it's not ideal. So yeah.
Totally. Okay. Danny, thank you so much for that. I think that was fantastic. If we can just have a round of applause in the chat section there for Danny. We're definitely going to be sharing the slides with everyone over the next couple of days. But thank you very much and have a fantastic day further. Cheers, Danny.
Thanks.